Hey, and welcome to another episode of the Odd Couple podcast. I'm Arjun,
I'm Siddharth.
And I'm Dr. Sheesh.
and I'm also dying.
Oh shit, what happened?
You have a doctor, Dad. Don't worry, I won't let you die there. It's
Okay.
my moral duty
But
to make
because-
sure you're alive.
I was just checking for like COVID symptoms and all that because suddenly it's like, okay, this might be a symptom, that might be a symptom. But then, so I Googled it and turns out I have Meniere's disease, which is an imbalance of fluid in my ear.
Arjun, you don't have COVID, you're just an idiot there. That's what you are.
Oh, like you care to elaborate?
No, but not idiot like an imbecile, but idiot like internet-derived information obstructing treatment type of syndrome.
Wait, hold on. Say it again slowly.
There's something called internet-derived information obstructing treatment. So the acronym is idiot.
Oh.
Wow.
So it's called the idiot syndrome for people who Google their symptoms and derive all type of
Self-diagnosis.
self-diagnosed diseases. Yeah.
Interesting.
So I get it a lot because I happen to, obviously, I'm sure everyone does also. I happen to do it a lot, and everything tells you you're obviously dying. You always go to a worst case scenario. Very rarely have I Googled something that tells me I'm all right. But from your perspective, do you have patients coming to you saying, Doctor, I checked it out and
Obviously, Dad, like hell yeah. Before the pandemic, it was okay, it was there. But after the pandemic, it is like crazy because most of them now don't come to the hospital because they're scared to come to the hospital. So they're just Googling their symptoms and trying to figure out what's wrong with them. And then all these preconceived notions are built up in their head. By the time they end up coming to us and telling us about their problem, they've got everything figured out in their head. So it becomes really difficult then to break down that whole castle which they built in their head. So yeah, after the pandemic, it's become worse, really, really bad, man.
Interesting. So it's basically an irrational fear of contracting a disease or something like that.
I guess it starts very innocently. Whatever their problem is, it starts very innocently because one is they feel like the internet, they are able to access most of this information there, which is true. The internet does have a lot of information. And two, with the COVID scenario, they don't want to come to the hospital. So then, yeah, where do you get your information from? Before you'll go to the pharmacist, if not the doctor, and then that pharmacist is just chugging some type of drug out to you. Only in India this happens, but yeah. Now they've skipped that guy also because everything is online, so they don't need the pharmacist Baba now. So they'll just Google everything on Google Doctor and then go to the online pharmacy and pick it up.
I am a hypochondriac. May not be clinically chronic hypochondriac. So what is it called? I'm not too sure.
You're not a hypochondriac.
I'm a hyper-vigilant and I
Yeah.
know that I live an inherently unhealthy lifestyle. And I always worry what's going to happen, or even a small, let's say a palpitation or a muscle fatigue, as you call myalgia, which is triggered by my anxiety, leads to obviously, as you said, Googling and becoming an idiot, which is the right opposite of what I really want to be. But I sometimes wonder, is the Google or any search algorithm, shouldn't it be smart enough to read symptoms to not automatically go to cancer? It's either you have a common cold or you have tumor or cancer and you're going to die in 6 months.
yeah, it goes to the worst thing.
There's nothing
always.
in between saying that, hey, go see a doctor, stop Googling. There has to be some kind of a warning like that.
No, I think they give you all that warning beforehand by saying that you should not take all this advice and you should go to your doctor for fine. I think they give that to you in fine print.
Yeah, that they tell you 99% of the chances that you're dying, but hey, go check out with your doctor first.
You just choose not to read all that so you don't have to pay me my consultation fees. That's all, Sid. That's all the problem is. I know it.
See, I think it's a very complex problem where one is self-diagnosis, then the other is obviously self-medication, which you diagnose by yourself and you self-medicate, which I think is even more serious than self-diagnosis because step one itself is wrong, then step two is obviously going to be wrong. And then you finally go to a doctor, and since you claim that you know a lot, you may not be 100% honest with the doctor about all the symptoms that's supposed to be serious. Is it harder to treat a patient who reads a lot and comes to you? Does it lead to misdiagnosis because he's read too much, he or she?
Yeah, I'll tell you why that is. It's not just the fault of the patient, it's also a doctor. So we are two humans who are going to be discussing this problem. So any patient who comes in and is giving me their symptoms, if he's Googled it before and now he starts having these preconceived notions as to what he already has because Google has taken him down this rabbit hole and he's gotten somewhere. Now, when he comes to me, right, and starts telling me his symptoms, you have to understand that for us, we are built in a way to reach a diagnosis. So we don't start with a diagnosis. We start with a lot of diagnosis. We put a lot of diagnosis into a box. So the minute you start saying, I have pain, I have this, okay, this many diagnoses go in. So now I need to, as I'm listening to your story, I'm throwing out a diagnosis, throwing out a diagnosis, throwing out a diagnosis. But when you start harping on something which is, this is more prominent because you read it in Google, so now you feel strongly about it. You are making me chase you down that rabbit hole with you. Now, normally I might not have done that, because I'd be listening to all your symptoms and playing with the diagnosis in my head. And then I choose what is more relevant to fit one diagnosis and say, okay, this is what your problem is. So that is the way it happens. It's not just you, but you take me along with your ride, and then we lose time, which we shouldn't have in the first place.
I think you should thank the hypochondriacs like me and other people who are, let's say, cyberchondriacs. I think that's the word that we can use.
Wow.
Did you just coin that word now, Sidhu? Go trademark it.
No. I'm not that smart.
Yeah, we already came to that point. You guys are idiots.
Like I was saying earlier, I think you guys should thank these cyberchondriacs. I think the whole industry of your testing and scans and everything is fueled by these guys, because when a cyberchondriac comes to you and they'll say, hey, doc, listen, I think I'm having this XYZ, and you obviously will not take it lightly. And you will ask for tests and scans to ensure that, to tell him, listen, there's nothing wrong with you at least. Here's proof of that. Because I think there are two types of cyberchondriacs. One is somebody like me who, by talking to you, Dr. Sheesh, and listening to you, I feel, okay, thank God, there's nothing wrong with me. I'm normal. Okay, these things are within normal range. And my anxiety levels comes down and I'm much calmer and I don't worry about it too much. But there are other people who have this whole white coat syndrome, which they get very worried around doctors. They don't trust doctors easily.
Yeah.
Probably because they're so hypochondriac that they have had interactions with doctors that who have never been able to diagnose them. And that leads to frustration. So how do you see this whole thing playing?
I think we have to classify them as two different patients, we have those guys who are genuinely like hypochondriacs. We have those patients who are malingering. Malingering is where they don't have anything, but they're just lying about their symptoms for attention or whatever.
Oh, okay.
So we have those kind of patients also. And then we have patients who are just have some type of disease or chronic ailment, which has gone undiagnosed for a very, very long time. I would put them across like that. And then you need to identify those people and treat them accordingly. Now, like what you said now, doing all these tests and everything, it's different. There's a patient, now let's assume now that you come in and you've got pain in your knee, and I probably just do an x-ray for you, and I see the x-ray and I say, you know what, your x-ray seems normal, your symptoms are not so bad, we don't need to further investigate, let's wait for some period of time and see if you're okay. But that might not satisfy you at all. So you're going to be like, no, I'm not satisfied. So either you're going to go doctor hunting or doctor shopping after that, which is you'll jump from this doctor to that doctor to another doctor. And everybody's pretty much nobody's going to follow what your problem is now, because you're just jumping. So ultimately, at the end of the day, what you wanted was an MRI to say that, okay, we've done the MRI scan also and you're fine. So you got to identify that guy who needs that. Now some person will hear, okay, like you, if I tell you and you trust me, you're going to be like, okay, we did the x-ray and you're fine. No need going down and doing an MRI. Another guy would be like, no, without you doing the MRI, how can you tell me I'm all right? So now most of the doctors will then go in and then start practicing just to be safe. They'd be like, okay, let's just order that MRI. It might be absolutely useless. Right. So you really need to identify the patient's psyche, and you're not just treating the disease, you're treating the patient also. That's the thing.
Okay, Dr. Sheesh, in terms of, you said hypochondriacs and malingerers, no? So the hypochondriac genuinely requires that kind of reassurance, right? Like he's fine.
Yeah, that stems from a sense of anxiety.
Yeah. Do you call out the malingerer saying, "Day, stop lying"?
I mean, you have to understand it stems from somewhere, right? Some form of insecurity is what comes out as malingering. So we have these, like when I was doing my residency program, right? It'd have these girls who'll come in all fainted with their boyfriend. It will bring them suddenly, the girl is fainted and stuff like that. So there's a very simple test which you do when she's lying down over there. One is you can take your knuckle and just rub it into their sternum and they'll just jump right up. Two is you lift the hand up, and if you leave the hand should drop right down onto the face if the guy is really fainted. Well, if the guy is malingering, his hand will automatically move away and, will not hit his face. It will avoid the face. So we got these small little tests which we do. And then the really, that the wicked nurse over there, they've got these like really pungent, for like formaldehyde and stuff. They just take it and put it to the nose. She'll jump for her life, Yeah. She'll just jump for her life. So we've got our methods there.
So Arjun, next time you faint, remember this.
I make sure that hand just goes splat on my head.
It doesn't. Go try it. It doesn't. You can't do it. As much as you try not to do, you can't do it. It's like you're trying to suffocate yourself by not breathing. It's not
interesting.
It's not possible.
I think we've kind of covered this whole hypochondriacs and your malingering. Malingering. Is it M-A or M-E?
M-A, I think. Malingering. You're asking doctor for spelling. Malingering, I think.
Okay, here's a good question. Is it because you guys don't know the spelling that you guys don't write legibly?
Yes. That is the honest truth. I don't understand why these buggers create such hard names when they don't know how to spell also.
Yeah. So Arjun, what's the spelling of diarrhea?
My ass.
Why is it Hoya? Diarrhea.
You should go back and ask all these old buggers who named all these names, no?
So I was reading an interesting topic the other day where I heard there's similar issues or similar fears or syndrome or sorts with medical students in their second year. Because they're reading so much about new diseases and everything, I think it's called the medical student syndrome or disease. Nosophobia, something like that.
Really, yeah?
Yeah, where these...
I've not heard of it.
Waste. I mean, it is a very interesting thing where all second years, not all, a significant bunch of second years, usually who are exposed to these diseases, and I think you have pathology or whatever it might be, that particular chapter, where they feel that the symptoms and stuff like that, and because they're reading so much about it, it's an overexposure to a particular thing that you end up being hyper aware about these things.
It's highly possible get influenced by it. But yeah, as a student especially, you be right when you're saying that, because as a student, we're playing with a lot of symptoms, but we don't know so many diagnoses. So when you don't have a knowledge of the diagnosis, then everything starts getting confused. So that's what we have to understand, actually, Sid. I mean, I just take it back to the whole search engine problem. The problem with why it really doesn't work with the search engine is just that, which is the search engine has a lot of diagnosis. It's the absolute opposite of what the student is feeling. The search engine has a lot of diagnosis, but the problem for the search engine is that we have very few symptoms. How many symptoms do you have? You have pain, you have stomachache, you have a cold, you have flu, you have a fever. These are the symptoms. Your body only has a few ways of saying it has a problem. So even cancer or your common cold is all going to have pain, is have fever or something like that. So now the problem for the search engine is it has so many diagnoses with so many similar symptoms. For a student, the problem was opposite, where he had a lot of symptoms and didn't have diagnosis, so he didn't know where to fit it in. The search engine is doing the absolute opposite. So that is why when a doctor is listening, he's got the diagnosis and he's listened to your symptoms, but there's also the history of duration, how long this has been there, the intensity. This you can't explain to the computer, right? How intense is that pain? How is it cruciating? Is it dull, aching? Is it there for a long? So, and then when you see it, third part of it, so you have the complaints, the history, then you have the examination part of it. So then you examine. So you've heard the history, got the complaints, and now you examine that part, and then you see, is it warm? You touch and feel. Now to you might feel like your whole leg is warm. To me, this part and the other part, it seems same. So when I examine you, I finally come down to the last bit of the diagnosis. So then it's a holistic approach which we use, which the search engine can't do. And that is why most of them will throw you down the thing finally. Okay, if it's not sorted with this, then you end up with cancer, because cancer has all the symptoms underneath it. So yeah.
So Arjun, congratulations, you're not dying. Nice. So yeah, I think it makes a lot of sense.
Dr. Sheesh, I wanted to ask you something about physicians using Google, because I read recently physicians using Google when they have, let's say, or 10 or 15 minutes or half an hour to check out information, they use a search engine,
Yeah.
second only to peers or colleagues.
See, it exists. I'm not going to say it doesn't exist. Everybody does Google. Even the physicians do Google. And my reason where I think that we do Google is, see, in your practice, right, you get caught into these diseases which you see more commonly. So most of the time when we are in a certain specialized field, you're seeing those type of patients. Now, when you have an off patient who comes inside suddenly with different history and problems, and chronically is having it and it's not been sorted out for a long time, then you've got to think outside the box. And so that's when all your experience comes into play. But having said that, you have to have an idea of what you're Googling, because if you don't know what you're Googling, then you're going to be searching. There's no difference between you and the patient. The physician will always have an idea of what the problem is, and he's going to be looking at it down that avenue and seeing and searching for something which is different from what he thought, and which could be a possibility, and why this patient has not been cured till now. So that's the difference of approach when a physician is doing it. We have to understand that all this information is great. It's not bad, but it's how we use it. So if the patient had come to me first and we come up with a diagnosis together that, okay, this is what most probably you're suffering with, and then the patient goes out and then Googles what we have come to a decision, it's between the doctor and him, what the decision of the diagnosis is, he'd probably have a better understanding.
And what about self-medication? Because I see a lot of abuse happening on that front. Because it is part of self-diagnosis, which leads to a lot of self-medication, which I mentioned earlier. Yes, it's okay for fever, cold, cough, all those minor ailments is fine. But when it gets to slightly more serious things, where I see a lot of people self-medicating and ignoring symptoms purely because they're just afraid of doctors or going to a hospital and they have a phobia on that sense. What's your suggestion on that?
I don't have any suggestion. You shouldn't do it, is my whole take on it. Because see, we have created such a problem today just because of our parents' generation. I think like my dad and his generation were the kings of self-medication. Anything, any fever, take this antibiotic. Anything, take this paracetamol. Take the span. They always are just throwing antibiotics at us for everything. And today, because of that, the amount of resistance which we have created to antibiotics, India abuses antibiotics left, right, and center. And when I tell my patient you don't need an antibiotic, they look at me like I'm a quack doctor. That's the level of the problem in India about it. And trust me, I'm sure our audience will relate to this because they've all done it.
Oh, yes. I think all of us are guilty.
Yeah. Any fever, pop a antibiotic. There's a really sad story which I heard the other day. I was taking before the pandemic, I was having a swim and I met somebody in the pool. And they're one of those scientists who study birds. So she was telling me that the vultures of India are completely dying because of, even in animal husbandry, they're using a lot of antibiotics there. And so because of it, it all gets transferred over to the next animal which eats it. And so, ultimately at the end of the day, the whole vulture line is gone. India per se has abused antibiotics, and we will definitely pay the price for it because the number of resistant strains which are coming up. And we're not creating antibiotics every day. So you got your set classification, and within that we're trying to create newer drugs.
So from this antibiotics and abuse of it, which is the classic side effect of self-medication, how about home remedies? Is that a safer route to go with, because it usually does not involve antibiotics?
Yeah, see, home remedies are okay. I don't have a problem. I do tell a lot of my patients to use a lot of home remedies because there's nothing, a lot of home remedies. Like, if my child has a cough, my wife would make honey, ginger, and black pepper and give it to my child. And that's a home remedy, right? Then using a hot water bag on a joint which hurts is a home remedy.
Yeah, I have two garlic pods every morning. I believe it aids my digestion, and my gastric issues have come down drastically.
Yeah, so that's why we have to be a little logical of what we're doing. Now, I tell my patients this, that, okay, you've got arthritis. Now, because you have arthritis, you cannot just sit down there and put a hot pad to your knee and get some oil from some Ayurveda place and keep rubbing it and saying it's going to go. It's not going to go. Invariably, you're going to go from a stage 1 to a stage 4, and then you're going to need to replace your whole knee. But if you identify what the cause for it was, because there are various causes for that. You could have a rheumatoid arthritis. You could have a gout. In gout, if you just alter your diet, you're sorted. You need to get a diagnosis. The problem is in India, we don't have a diagnosis. There's very little attention which is put into making that diagnosis because everybody is doing symptomatic treatment. So if I just treat the symptom, then after 1 week, I forget the doctor, I forget everything. We don't need a diagnosis for it until the next episode. Right? But if we sort it in India and we make diagnosis, then you give the patient the proper remedy, which is, and sometimes home remedies might just be enough also for it. But you need that diagnosis.
Dr. Sheesh, when you talked about like making diagnosis, and I had this uncle who was a doctor, and his main problem is he said no one does clinical diagnosis anymore. You don't have a doctor who like gets into the root of the problem. He says he brought about the whole why your family doctor knows best, because if you go to a hospital, there's like, okay, fine, that 3-day running fever or that ache in the knee or whatever, sorted until next time. His whole rant was about there are no clinicians. Is that the term?
Don't exist?
Yeah, and no more. Not don't exist. He says you don't have a doctor basically. His basic thing is you don't have a doctor tapping your knee and opening your mouth and reaching in.
No, yeah. I mean, come on. See, if you look at it, India's got the best of both worlds, if you ask me. As much as we complain about India, it's got a great medical system which has worked really well with whatever resources which we have. And compared to most worlds, we have a government system which provides free treatment for patients as well as a private setup which is there for all high-end stuff and for people who can afford it. Now abroad you either have like you're either paying through your nose for it, or you've got something like the NHS or what is there in Canada, where there's socialistic medicine. Both have their drawbacks. I think we've evolved from the general physician, but the role of the general physician is still very much there. The MBBS doctors now, they feel like, oh, maybe they don't have such an important role to play like they used to play before. Because, after MBBS, they were the guy who used to treat you holistically for your knee and everything. Now, if you go abroad, you have to see a GP. Only once you've seen a GP can you go and see a specialist. But in India, you have that option that you can go directly and see a specialist. You don't need to stand in the line, see a GP, then get referred. So if you've got a knee problem, you're going to go and see an orthopedician. You've got chest ache, you're going to go and see a cardiologist. A lot has changed in that sense that the GP guys don't have so much of a role to play, and it's more like the specialty people who are playing now. And that's why he feels that way. But they do exist. Yeah. It's not like they don't exist. In the 2-tier cities and all, especially, they have a big role to play.
So how should people get the information? One, yes, there is an over exposure to information. Everything's at your fingertips. Now, what is the best way to go about it, especially for people like me who are hypervigilant, borderline hypochondriac, who is wondering why there's a palpitation, or why is there strange twitch in my finger, or why am I breathing? Am I breathing heavily right now? Does that mean I have coronavirus? Immediately start checking. So, what is the best way for us to gather information, and when is the right time to reach out to a doctor?
There's never a right time. When you have a symptom which is bothering you, when it becomes such a tick in your head that you need to Google it, it means you need to see a doctor. Now, like what Arjun said, I think we pretty much eliminated that middleman who was your GP, your general practitioner. And ideally what you should be doing is, instead of Google, going and seeing him. And he would sort out the problem then and there and say, no, you know what, you're paying too much attention to this stuff, just let it go. Or no, you know what, it's better you go and see a specialist, but we've eliminated that guy and given the role to Google.
That's a super point, actually, if you think of it, no? I mean, you have a doubt. You usually used to go to a family doctor. Now you have a doubt, you go to Google, and then you decide it's an ortho problem or a neuro problem or whatever it is, and then you go make an appointment.
Oh, I completely agree with that because having somebody who you trust, who has actually spent 5, 10, 15 years studying this, so go to them, trust them. They know much better. They obviously seen far more cases on this particular front, and they can probably guide you much better than probably a search engine algorithm which randomly throws out the worst case scenario. And like Arjun said earlier, he's going to die, but hopefully he's not dying.
Eventually, da.
Eventually, so will all of us will die. That's the permanent solution to all symptoms.
But there is something even more dangerous than Google. You know what it is? It's your neighbor. I swear to you.
The neighbor uncle attacks again.
Really, really, really. So, anytime you are discussing your modality of treatments and everything, and you and your patient come down and you've come down to a diagnosis, and you finally tell your patient, okay, this is what we're going to do for it and sort the problem out. Probably it's surgery or whatever it is. And then they look at you and they'll be like, sir, but my neighbor was telling me that we should probably do it like this. And I'm there looking at them thinking, dude, I've invested so many years sitting, educating myself, and I'm giving you an opinion. And your neighbor's probably either a coder or an accountant or your pal Karan, and he's giving you the opinion, and you value it so much over more than what the doctor says, right? So, which is really, really weird.
Yeah, if you have a doubt about this uncle or this neighbor, please refer our first episode. We have discussed extensively on this topic. So do not trust your neighbor, at least for this particular thing. Let's trust people. It is both your neighbors as well as your relatives. They'll say, oh, I had this particular thing. Don't worry about it. Everything will be fine. The thing is, the certain things you have to take seriously, certain things you shouldn't. But it's best to allay your fears and doubts by consulting a professional, whether it's physical or mental.
And there's a story which comes to me about these young parents who had come with their child. What happened was their child had fallen and had broken their bone. And their near and dear ones advised them to go and undergo native treatment instead of coming to a hospital. And it's very common in India to have these bone setters. There's this local area where there's a lot of these bone setters, and they go there. They tied the bandage, or they set the bone and they tied it up so tight that ultimately the vascularity was compromised, and finally the hand turned gangrenous and had to be amputated. And that was a huge price to pay for a small child, especially because of the ignorance of just not only the parents but their own well-wishers. I always tell them that out of the 10 patients who go to a bone setter, probably 5 or 6 of them will all have good results, and they only see the good results. But the other 4 or 5 patients who have bad results, I see them all the time, and those patients really have it bad for them. So that is why I feel sometimes the ignorance is causes them to pay a really heavy price. Another story which happened very recently to one of my friends, and this is a really funny one. I mean, in the sense, it was like he had some gastric issues, he had some indigestion or whatever, and he called up my friend, and my friend gave him a medication for indigestion. He went away for a day or two, and then he got back to my friend saying that, what, I took your medication, and after that I developed this lesion at the back of my shoulder. So my friend was like, really? Okay, stop the medication if you feel a thing. He's like, yeah, because I googled this, and one of the side effects which came up was this type of irritation, redness, and lesion. So I stopped it, but I just wanted to tell you that please don't prescribe this type of medication. My friend was taken aback, but he was like, okay, what, maybe so. So he asked him, can you show me your lesion? And he saw the lesion. He was like, this doesn't look allergic, man. This looks like it's probably a herpes lesion. And that guy was like, please, it's okay, enough. I just called to tell you, don't give me any more advice on what medication to take, etc. Anyway, this guy is gone, and he's left it on like that. And now he's developed post-hepatic neuralgia, and now he's not able to move his hand. And now he's undergoing treatment for that.
He can never click on a link again.
He didn't know the cause, and he thought he understood what the reason was because he Googled it, and and again, he paid a heavy price for it. So this is what I'm trying to say. There are a lot of bad apples in every industry. I'm not going to stand and defend that. But having said that, if anybody has your best interest at heart, it is your doctor. Because every doctor is trying to create a career for himself. And his career's growth will only grow by word of mouth. And only if he's done a great job for that patient and that patient is relieved of his pain or his ailment, will that patient ever send another patient to this guy. It is in the doctor's best interest that he does a great job.
Yes, we as highly ignorant patients, we complicate things, I think, for ourselves by Googling a bit too much. Just go to your friendly doctor, neighborhood doctor. Trust him, he'll guide you the best. Not all doctors are out to get your money. But just because of few bad apples, do not put yourself at risk and trust your own ignorance by either being scaring yourself by Googling stuff or ignoring some really important stuff. So, yes, do Google, do all of that, but also see a doctor at the same time. It's very important for both your physical and mental health to go see a professional. Please do it. So, it was a lovely chat, Dr. Sheesh, Arjun.
Should we give Dr. Sheesh's number here? Or
Thank you so much, Dr. Sheesh. I think this chat itself has alleviated a lot of doubts from my own mind, which and few symptoms have suddenly died down even within me. So thank you so much, guys, for tuning in. Do subscribe to us on Instagram, YouTube, Facebook, as well as at Twitter. We do run some really fun contests. There's a fun contest coming up soon, so watch out the space. Until the next time, this is Siddharth.
This is Arjun.
And this is Dr. Sheesh. Goodbye.